my name is Maureen Afula. I am from Nairobi, Kenya. Last year, I began experiencing some abdominal pain and I went to hospital back home in Kenya. So the first time they thought I had H. pylori. So they treated me for 2 cycles, but the pain continued. It became worse and worse over time. So they did an ultrasound. They saw that I had a growth in my pancreas. That made me panic. I had breast cancer and I was treated successfully in India. So I panicked and I went back to India to see what the problem was. And after about 3 weeks, they confirmed I had pancreatic cancer. So they gave me options. So they said because my tumor was localized and it was a little bit too big, it was not dissectable. They needed to shrink the tumor. The best they said was going to be the nanoknife, but I didn't have money at that time. So the second option was chemo. So I went through 4 cycles of chemo, and after the 4 cycles of chemo, nothing had changed. Of course, I was very disappointed. So when I went back to the doctor, they said they have done the best they could. I just go back home. For me, my biggest challenge was pain. Yes. The pain was unbearable. And that's how I got in touch with Dr. Abuti, who is affiliated with this hospital. So he told me about FUDA, and he told me the different options that would be available for me. But the first thing he said that they would need to do is to manage my pain. So finally, I got ready and I came to FUDA. We arrived late at night. The canteen was closed. We were hungry because we'd been traveling the whole day. We didn't have any local money. Wendy, the nurse, went into her pocket and gave us money to go and buy food. For me, that was kindness I'd never experienced. I love the way the nurses come every morning. They're professional, but they also are very, very friendly. The doctors do their rounds every day, including Sundays, which I think for me is remarkable. And the voice of the patient is very important. Sometimes I'm not very happy with the painkiller or I'm concerned about the side effects. And Dr. Pang will always listen and try and find something that works for me. That already gave me hope. And he again talked about nanoknife. What surprised me most is that he told me it will take like less than an hour. Talking about they've been doing this since 2013, 2014, more than 1,000 procedures. So that's also inspired confidence in me. Yeah. I think in the second week I had the nanoknife. It was a bit tough, but I must say the support in ICU was tremendous. And when I talk about a miracle, by day 7, suddenly I began feeling hungry. Before that, I never used to feel hungry. So the pain was gone, my appetite was back, and I began eating. I was 47 kilograms. But by the end of month 1, I'd gone up to 52 kilograms. When I went back home, I went to see my doctors. And when they saw me, they couldn't believe it. Because when I saw them in June, it was just like a matter of time I will be gone. He thought it is somebody who was risen from the dead. So I told him about what had happened in China. I told him about the nanoknife. So he told me, you know what, whatever the Chinese are doing, just go back there because we cannot do this for you. So I came back, we did another scan. The scan showed that the tumor is stable, which according to Dr. Pang is good news. After the nanoknife, I needed to do immunotherapy and then microvascular interventional chemotherapy. So I had 2 cycles of immunotherapy and 2 cycles of microvascular interventional chemotherapy. In between, they keep monitoring my blood, especially and the platelet count. And if there's any problem, I normally get like a booster injection to bring up the white blood cell count. And I think every time I come, they do an ultrasound to check and see how I'm going, which again also gives me confidence. So the treatment is actually very good. And physically, I mean, if you look at me generally, I am much, much better than I was. When I look at breast cancer, it wasn't very serious. The pancreatic cancer has been very tough. But also, when I look at the treatment, especially here in FUDA, I think the treatment has been very thorough. I think I'm very privileged to have gotten, I would say, the best of the best treatments that is available out there. So for me, my whole journey has been very holistic. I was worried about the language barrier when I came here. I was like, I don't speak Chinese. How will you communicate? But it hasn't been a barrier at all. We're able to communicate. I'm able to say what I want, and the doctor can express himself. So for me, it's been very, very wonderful. What impressed me is that even the Muslims have got where they can cook and other religions can have where they can cook. It's a deciding factor whether you go or not. In many hospitals, you feel like a prisoner when you go to hospital. Here, you don't feel like a prisoner. It's like home. When you're sick, you get very irritable. But here, you remove all the irritations I think your culture of compassionate care has rubbed on to even the patients who come here. Because patients are also very nice to each other. My neighbor next door noticed that my sister's not around. And she came and told me, you know what, I'm going to take care of you. So I feel like here, it's family. So I think you're doing a wonderful job. And I've been to many hospitals. And somebody was asking me, who would you say is really JCI accredited? I would actually say, I think FUDA is. You would tick almost all the criteria in the JCI accreditation framework. So thank you very much for making it easy for me to walk this journey. If I was to talk to other survivors, I think for me it's very important never to give up and be open to experimenting. Some technologies such as nanoknife, people may have reservations about them, but I think for me what I've seen is that they can be life-saving. Keep your mind open. The universe will conspire to make your journey work for you. I have hope that I can live with the cancer, which I think is very positive. And every day I'm feeling much, much stronger. Yes.